site in West Palm Beach has been operating, I think, for a week or so. If you look at Palm Beach County, there's a need for even more testing there. So that's up and running. Folks have been coming through today, and we're going to keep that running for as long as they need it. The other thing we are going to be doing, we're working with UF Shands. We've provided a number of these collection swabs for them. They're going to do two things in the Jacksonville area. One, they're going to offer clinical support for some underserved populations. So I think they've identified some public housing areas to be able to offer testing for folks who may have symptoms. Now, of course, everyone who has the symptoms and meets the criteria, regardless of where they live, is able to get the drive-through sites that are up throughout the state. But I mean, not everyone knows about it. So they felt and we felt it's important to make an extra effort to reach out some areas that may be underserved. So they're going to be doing that. There's also going to be a research component to it where they're going to be looking at kind of a broader cross-section of people and specifically more of a surveillance type testing. And that will just help us try to understand to the extent to which people who are not symptomatic may have this, and I think it will contribute to our understanding of how this disease is affecting the broader community. They did a clinical at the Villages, did a number of folks there, but then they also did a research component at the Villages. I think this was a few weeks ago by now, and they did, I think, between 600 and 1,200 asymptomatic people, seniors, and the results were 0 tested positive. So we'll see how this community surveillance in the Jacksonville area will work, but I think that that's important because it really helps inform us in terms of what additional steps we can take. So the total tests in the state of Florida, we're closing in on 140,000 total tests completed, and that's pretty much ongoing. I think it's been pretty consistent in terms of the number of tests that are now being completed a day. We also continue to get good news with this Abbott Lab rapid test. So this can give somebody a positive result in 5 minutes. So they sent it to a number of the hospitals. Not all the hospitals had it, so we've asked the hospitals that do have it to make sure some of the other hospitals in your area have it, and so that's being done. If there's any hospitals out there that still don't have access to it, let us know. We'll work to get you some of these machines because when you're talking about protecting the healthcare workforce, when you're talking about identifying patients as they first come into the hospital with certain symptoms, to be able to rule out somebody for COVID, that really helps the hospitals be able to make the best use of their resources. We also now have at the Florida Department of Health a number of these Abbott Labs machines and tests, and so those will be deployed, combination of some of the higher outbreak areas, Southeast Florida, but then also used to do some spot checking at the most vulnerable populations like our nursing home population. So that'll be done more on a mobile basis. So I've told Dr. Rivkes to please move forward with that as quickly as possible. And so they're finalizing the plan for that today. But this really gives you a lot of options with this, and particularly with whether you have somebody in a nursing home, they're in the hospital, they have symptoms, we don't know if they have COVID, you have to wait 5 days for a test. A lot of hospitals, if they're stable, would want to send them back, but then obviously if you're COVID positive in a nursing home, that could create an outbreak. So now you have the ability to really know, and if you have somebody who may be sick but doesn't have COVID, well then that's a much different situation. So I think that'll be something that is very important. In terms of the travel update, since we instituted screening from the hotspots on the East Coast, mostly New York City area and New Orleans, we've screened almost 15,000 people by both air and by car. We'll continue to do that. Hospital capacity statewide, we're at 43% capacity for beds. Miami-Dade is at 43% capacity. Availability. Broward, 46% availability. Palm Beach, 49% availability. Hillsborough, 41% availability. Orange, 44% availability, and Duval, 47% availability. Day to day, in terms of new hospitalizations, pretty much it's Miami and the rest. They had 59 COVID-related hospitalizations trends there. Broward had 1 new hospitalization, Palm Beach, -7, Hillsborough, 0, Orange, 5, and Duval, -7. So obviously, that's probably one of the most important indicators in terms of how this thing is progressing in the state of Florida. So I want to thank everyone who's been involved in the fight. One of the number one questions we've been getting in the state of Florida is what treatments are available. And obviously this is a novel virus, so there's not really an approved treatment regimen. One of the things that physicians have been using is this hydroxychloroquine, usually combined with the Z-Pak. I was able to work with Teva Pharmaceuticals to get some of that distributed, a lot of it in southern Florida. Teva was having problems getting this out of India recently, so they did the first shipment. Then they told us, like, India's not letting any of this there. That's where their factory was. I spoke to President Trump, and then he spoke to Prime Minister Modi, and Modi has made an exception for the United States, so Teva is bringing more of this into the United States. They have sent a second shipment already to Florida hospitals. It shipped yesterday. That includes not just the hydroxychloroquine, but also the Z-Pak, which is something that they're using it with. And then we have Amneal Pharmaceuticals. We got 1 million doses coming to Tallahassee. It's supposed to arrive tomorrow. That will immediately be sent out to hospitals throughout the state of Florida. And so, as this thing was first discussed in Washington, then the FDA made their decision on it. I've reached out to physicians and just, asked, hey, what's the deal with this? Should we get more of it? I mean, because we want to obviously give patients all the opportunities to have a recovery. So I have with us here on the video screen Dr. Sunil Kumar. He's the critical care and pulmonary medicine at Broward Health. With this, it's interesting and great to see our physicians really having to innovate on the spot. A month ago, we knew a lot less. They learn more, but even by the hour, they're learning more. So I wanted to ask Dr. Kumar, can you explain kind of what you guys are doing now in terms of hydroxychloroquine treatment, but also some of the other innovations that you guys are doing to be able to treat your patients that have COVID-19?
Good afternoon, Governor. So we took hydroxychloroquine in 2 different steps. So initially, like you said, when these patients are admitted, some of them get really, really sick. And we didn't have too many options. So in the initial stage, we started using a combination of hydroxychloroquine and azithromycin, or Z-Pak, like you mentioned. As of yesterday, we changed the strategy a little bit, and we started using hydroxychloroquine and azithromycin in some patients, hydroxychloroquine and statins in another group. But we decided to start treating all patients diagnosed with COVID-19 admitted in the hospital. But I had to be very careful. I don't want people to assume that's the only thing that's available, but that is a medication that's been used for a long time. It's being tested, but we're not sure whether it will work. Along with that, we are using several other therapies. We are, like you mentioned, we are changing strategies hour by hour. We're using some ventilator strategies that's helping. We are using something called proning that's very well documented in the medical community.
Can you explain that for the layman, what that means?
So what we do is, patients usually when they're sick, they're lying down on their back, and these patients are intubated. They're on a machine. What we do is about 6 hours they lie on their back, and for the rest of the day they lie on their stomach. So we turn them, and with their face down, they're lying on their stomach. And this seems to be working. This seems to be helping very much. And, the respiratory distress syndrome that we are seeing in COVID-19, they're behaving a little different than the rest of the disease process that we see in other diseases. So we're trying all different modalities. So it's not just a medication alone. It's a combined modality that we are trying.
So, understanding the limitations on what you can say about hydroxychloroquine, and obviously we'll probably learn more about it every day. You do think, though, at least having that as an option, you would like to have that as a physician as an option to be able to treat the folks who come in with it?
Absolutely. I think we need to have every option that's available for these patients. Some of these patients are very, very sick. So everything is available, and that's the right way to do it.
And I know you guys were able to point us to a patient that was in some pretty rough shape. I think we have a testimonial from the patient, and so we're going to ask if they can play that, and then I'll come back to you for a few comments to wrap it up. So can you guys cue up the video of the patient?
When I got here, I couldn't breathe. Everybody here has treated me openly, fairly, and with good faith. Worked really, really.
Okay.
Really.
To help you.
You guys saved my life, and you know you did. And I'm lucky that you took the time to try, because other places wouldn't have.
And we're lucky to have you here.
Well, to me, that's very powerful. I mean, obviously, you guys are making sure to leave no stone unturned in treating these folks. And this was an individual that was in really rough shape. You look at COVID-19, and it's true, the vast majority of people that get it, particularly in the younger demographics, don't end up hospitalized and sometimes have mild symptoms. But, the people that this puts in the hospital, I mean, this really isn't like the flu. I mean, this is some really serious complications, and it can go downhill very fast. And so to be able to have a variety of options is very, very important. What would you say to folks in terms of looking forward? I know you say you're learning a lot more. What are some of the things that you're looking at in terms of how patients respond to a variety of things that you do? And then what are some of the kind of unanswered questions about this that you would like to have more information and data on?
So definitely hydroxychloroquine, we don't want to assume that's going to help everybody. I think we need to continue with aggressive efforts to do a randomized control trial, which is being done. We have other medication that's available. There is something that we are trying on these very sick patients that's called nitric oxide treatment. So we are trying those. There are some novel therapies available other than hydroxy. We are trying those medications. So we are learning, like you said, every day we are learning something new and we are applying. We are not shying away from trying things that's to help patients. And I'm pretty confident that we will get to the bottom of this. We will be able to help these sick patients. I think things will work out.
Great. Well, I just want to thank you for all the great work you're doing, and thank all your other colleagues, the physicians and the nurses, who are really stepping up. Floridians are watching and are very appreciative. So I know it's not been easy. It's probably not going to get easy, in the coming days. But just please know that you got a lot of appreciation throughout the state of Florida. So God bless.
We want to really thank you for all your support and your leadership. And again, I want to thank personally all the nurses, respiratory therapists, pharmacists, and all the intensivists and physicians across the country working really, really hard to protect and prevent further damage. And we'll continue to work hard. Thank you.
All right. Thanks a lot. Appreciate it. All right. Well, we have to thank Dr. Kumar for taking the time out. I also have Carlos Campo, physician here at Tallahassee Memorial, head of the intensive care unit. And can you just talk about with something like a hydroxychloroquine? I know there was a story about some layman just buying, they thought it was like the fish tank stuff, and obviously had a very adverse reaction. This is something that a physician recommends to use under supervision. That's one thing, but is this something that someone should just be messing around with on their own?
So hydrochloroquine is a medication that's been around for quite some time. It has been used in some autoimmune conditions like lupus, but it's not without side effects. More so when you use it in combination with a drug called azithromycin, a Z-Pak. Both of these drugs can prolong, when you're having an electrocardiogram, there's a part of the electrocardiogram that we call the QT. And both of these medications can prolong QT, which can lead to arrhythmias, disturbances in the electrical rhythm of the heart, and sometimes these arrhythmias can be fatal. And that's why when you use these medications in conjunction, you need to have an EKG, you need to be supervised. There's a special protocol that we have when we use these medications in conjunction. I would not recommend just starting these as an outpatient because obviously patients cannot be monitored, and again, the medications themselves can put the patient at risk.
So basically, this is something that it should be an option, but the physicians really need to be supervising the patients. It's really important that people understand that.
Absolutely. And again, I think that it's, like Dr. Kumar said, we're trying different options. There's data also that medications called statins, which we use for cholesterol, may reduce viral replication. Some of those medications are included in some of the protocols that we have looked at. There's data that vitamin C, vitamin D, zinc may reduce viral replication. We're looking at all the protocols that are available to manage these patients.
A little bit of a shifting gears, just, we talk about, I always give the update on the bed availability. We've taken steps here in Florida, such as halting elective surgeries to make sure that we have enough PPE and space. But then now you're seeing stories about healthcare workers getting laid off. Obviously there's not as much business coming in as there was. I think I looked at the numbers on March 1st of this year. The occupancy in Miami-Dade and Broward was 88% in both counties. Now it's under 60% in terms of the occupied beds. And so that obviously causes some changes in what's going on. So can you speak about any effects that may be happening? And then obviously, this is the task at hand. We want to make sure we're doing what we can here with COVID-19, but is there a way to mitigate some of the problems, that we may be seeing develop with people getting laid off or people not having the ability? Because, some non-essential may not be essential in that very minute, but a lot of this stuff is beneficial for people's health.
Sure. So again, like you said, the volume is down. I think elective surgeries are not being performed. Emergent procedures are being done. TMH, some emergency open heart surgeries have been done. I think in our office, what we've done is we're partnering with TMH and surrounding communities, other practices in other counties. We're using a lot of telemedicine. CMS has allowed for alternate devices to be used to be able to see patients at home. And a lot of practices that I have spoken to in Tallahassee and outside of Tallahassee are shifting to telemedicine to be able to provide care for the patients so that they don't have to come to the office, so that they're not exposed, so that they're not exposing other patients if they're all in the waiting room.
Great. Now, do you recommend that, obviously this is an ongoing situation, but, if there's a clear trend in a given area where, you're not seeing, increased hospitalizations from COVID-19, that in different areas, would you recommend that there be elective surgeries allowed at that point, or how would you view it?
I think that's a decision above my pay grade. I think that, again, but you have to wait and see how this is going to play out. And I think when each area is going to peak and surge in a different way. And I think you have to wait and see what each specific area in the state is going to do to decide then how to move forward.
Great. Well, I want to thank both the doctors for participating. We're going to continue working on hydroxychloroquine and anything else that we can do to be helpful. I will also add that we have I mentioned that I've spoken with the CEO of FedEx to help if people want to have the applications for unemployment printed there, that they would print it at no cost, let them fill it out, put it in a box, and then they would send every night to Tallahassee the completed application. So that has been finalized. So that will be, probably some stores are already allowing it now, but certainly they will be throughout this week. So that is another option for people because not everyone has access to a printer. And so you need to be able to find the application, and I know they have a lot of stores throughout the state of Florida. I also know that places like in Miami-Dade, they're working really hard to give access to the paper applications, and we appreciate that very much. You know, we did have we had 250 new call takers in place yesterday. I think we're adding to that today and tomorrow as well, and clearly view this as a priority and devoting a lot of resources to it. And with that, I'm happy to take some questions.
Hey, Governor, a number of elections scheduled, more than a dozen municipalities around the state over the next few weeks. People are asking, some supervisors are asking that they be postponed to the August primary.
So if it's any supervisor request to me for that, we are going to grant. I know Pasco has done it. We said we're fine. There was I know that Polk County had some municipal stuff. They wanted to go because they think almost everyone voted by mail anyways at this point, and so they thought they had social distancing. But certainly anyone that requests to me pushing off to August, I don't think there's any election that couldn't be done at August. I don't think we'd lose much. So I'm happy to work with them on that. Yeah, we obviously don't want to do that. I mean, there's ways to do it where you're not having people violate the social distance. This is obviously something that's critical for a lot of people, but I would just ask, as this is being done, to make sure that you're keeping, the physical separation. If you're handing out applications, I mean, you could even just let people drive up and hand it into their vehicle if you have it printed out. So please do it in a way that's not going to contribute or contribute to spreading this this disease or undercutting the efforts. And I'd also say just be careful on some of the things. I mean, we have like restaurants are closed. This is closed, but like the grocery store, people will just pack in there, and that may be a situation to wear like a face covering, cover your nose and mouth going into like a grocery store. If you're just in your front yard. I don't know that you need to do that if you're not near anybody, but when you're in those areas where you're going to be having close contact with people, that's definitely something that you want to think about doing. So don't crowd, just spread out, do it in a way that's orderly, and everyone will be fine. But if you start packing people in, that's not a good situation for us.
Governor, one of the things that I talked to Senator Diaz about today was the education system, where we're at with distance learning, and he was suggesting that it might not be a bad idea at this point to just let the kids do distance learning the rest of the school year. I don't know where you're at with that. Do you think that's a good idea?
I have not made that decision. I mean, look. Obviously, we want, we need to see this through from a safety perspective. If we are in a situation where, we've turned a corner and we think that we're on a road to safety, I think a lot of parents, kind of like to have the kids be able to have access to school if it's safe. And if they have a choice and they know it's safe, I think most of them would prefer that. So, but what we're going to be doing, I'm going to be doing a roundtable probably this week about all the education issues. I mean, I think a lot of parents, this is like a whole new world to have the kids there. You have some of this online curriculum. And it's not easy. It's not easy for anybody. And so we're very sympathetic to the challenges, that a lot of the parents are going through on this. So, and there's different strategies that have worked. There's some that haven't been as good. Some schools have, I think, done a little bit better than others. So there's a whole bunch of things that I think people have had concerns about. So we're going to try to help with that. I have the education commissioner working on it. So we'll probably have a parent, a teacher, an administrator, and then talk about some of the best practices, talk about some of the problems that we've seen. But I think, look, if I could snap my finger and know that this wasn't going to be an issue in terms of the virus, I think most people would want the kids back in school. But obviously, we need to be safe and do it in the right way.
Governor, there's so with the hospital, Hawkeye's hospital count shows that if you have COVID-19, are you more likely, this might be for Dr. More likely to have to go to an are all 60,000 hospitals?
So I could just give you like the number. So you have like in Palm Beach County, total hospitalizations 134. total ICU of those is 64. And I think the percentage of ICU versus not ICU, I mean, for example, Duval 62, total hospitalizations 22, ICU. That is really going to be dependent on who is getting infected. I mean, if you're having people who are 65 and plus, people that have diabetes, people that have some of these underlying conditions, the chance of hospitalization obviously increases, but then the chance of being in the ICU increases as well. So those are, ACA is maintaining that. And so if you look at the ICU bed availability, 35% in Miami-Dade, looks like 48% in Duval, 36% in Broward. So these are things that are being monitored, on a daily basis. So, okay, well, thank you all. We'll see you tomorrow.